There are a number of other kinds of HIV tests which may be undertaken, not usually for diagnostic purposes but instead to monitor the health of someone living with HIV. A viral load test is a lab test that measures the number of HIV virus particles in a milliliter of your blood. These particles are called copies. A viral load test helps provide information on your health status and how well antiretroviral is controlling the virus. A CD4 count is a lab test that measures the number of CD4 T lymphocytes, CD4 cells in a sample of your blood. In people with HIV, it is the most important laboratory indicator of how well your immune system is working and the strongest predictor of HIV progression. A polymerase chain reaction or PCR test is a kind of HIV test which tests directly for the presence of the virus, unlike an antibody test. It does this by detecting the virus's genetic material, DNA RNA, and then amplifying it millions of times so that it can be detected by a special machine. These tests are very expensive, typically 20 times that of a standard HIV test. In some circumstances they are used to diagnose HIV, and they can accurately detect HIV as early as 3 days after infection. They are usually only used as a diagnostic test in people who do not develop a normal antibody response to HIV infection, for example very young babies or people who are already immunocompromised for some other reason.